My name is Beth and I'm a mat Pilates teacher at Bodysets Harley Street. I'm here to talk to you today about the benefits of Pilates during pregnancy. So is Pilates a good thing to do when you're pregnant? Yes, would be the short, snappy, simple answer. I'm sure you want a little bit more detail than that. So this is what this video is about. The general benefits of exercise during pregnancy are well known both for the mother and for the baby, both for the physical and mental health of the mum and the unborn child, with no adverse effects to the baby. But Pilates specifically offers a huge amount of benefits all through the trimesters and postnatally as well. Probably most importantly, it encourages us and it helps us to think about our body. So as a woman, when our body shape is changing, our posture is changing, our centre of gravity is changing during pregnancy, Pilates is a method that helps us understand that and then understand how to counteract that and move safely and in good alignment. So Pilates during pregnancy offers us a way to think about our posture and to reduce any aches and pains really that come along with pregnancy. We also focus on the breath, connecting the mind to the body to the breath. And this is super helpful, especially for the later stages in pregnancy when we can practice breathing techniques. We can up the oxygen intake, obviously beneficial for both mother and unborn baby. And we can really focus on calming the mind with our breath and our breath patterns. Lastly is our core, our centre, and we've been focusing such a lot in my Pilates classes on the pelvic floor, both on how to engage the pelvic floor, but also on how to release the pelvic floor and how to release the pelvic floor completely. That's very important, particularly in the last trimester preparing for birth, that method of that full release to help us as we prepare to go into labour. Now, I'm a specialist pre and postnatal Pilates teacher, and I would certainly suggest that you seek out a specialist teacher before going ahead with your practice, mainly because there are lots of things through trimester 1 to 3 that change when it comes to exercise, when it comes to Pilates postures. Things that we can perhaps do in the early stages of the first trimester will just not be advised in the later stages. So it is good to seek out a professional to give you that insight and that advice. So we think about our pelvic floor a lot in our pregnancy classes, as I've said, but we also think about mobilising the spine, mobilising the hips, and really building strength in the body for birth. So we'll be building strength in the triceps, at the back of the arms, doing lots of Pilates squats to engage the glutes, the hamstrings, the hips. We're doing some footwork, releasing any issues in the feet there, any tightness in the fascia of the foot, and lots of things like that. But one particular posture which is helpful through the trimesters and which can also help us as Pilates teachers to encourage your baby into an optimal position for birth is our 4-point kneeling position. So I'll just quickly show you that now. Some of you may well be familiar already, but it's that positioning, that start position where we have our hands under our shoulders, knees under our hip points. We've got the navel engaged, back of the skull pressing towards the ceiling, and this is a nice safe position to exercise for all trimesters. We can focus on work on the pelvis, we can think about the hip, we can think about spinal rotation, but today we're just going to have a look at lower spine rotation, lower spine flexion. So side flexion here with our tail swish. Quite a funny name for an exercise, and do we basically imagine we are a dog with a tail, that being our tailbone. And this is a really nice one, particularly for those later stages, so 35 weeks and after, where if your baby is not in an optimal position, and even if it is, it's a nice one to kind of gently encourage the baby into a better position for birth. So we've got our neutral pelvis, our neutral spine, navel drawing in, back of the skull pressed to the ceiling. We take an inhale to prepare, and as we exhale, we just think about drawing the left hip bone up towards the left shoulder. So top part of the body is not moving, but the lower spine is coming into flexion. Almost like we're swishing our tail to the left, very gently. We inhale to bring the pelvis back to centre, so the tailbone will be pointing towards the back wall. And on your next exhale, Bring that right hip bone towards the right shoulder. Gently switch the tail to the right. Inhale, drawing the pelvis back to centre and to neutral. So it's lower spine lateral flexion, and if you like, you can add a bit of a head turn. So you'll be looking at your left hip when it draws up towards your left shoulder. Remembering to take the skull back as you take the pelvis back. Last one. Imagining there's a little string pulling that right hip bone up towards right shoulder. And then drawing back to centre. Okay, and then coming to a nice comfortable seat. Optional extras that you can use in your practice. Cushions are always helpful, as are blocks as well. All right, thank you very much for listening. Take care.